Hello, myself Dr. Prashant Pawar, consultant cardiologist, Fortis Hospital, Vashi. Today, I'll be speaking about an important cardiac topic, that is heart failure. Now, heart failure is very important because the incidence rate, the number of patients who presents with this illness is increasing day by day. It is a major concern in our country because patients who have heart failure, they have a poor quality of life, and those patients are also at high risk for sudden cardiac deaths. How this is? Why poor quality of life? Because many times they present again and again with breathlessness, where they require some sort of ventilator called BiPAP. Their day-to-day activities are hampered. They require some support. And why sudden cardiac death? Because many patients who have this heart failure, they have a risk of arrhythmias. Arrhythmias means patients whose heart rate suddenly goes very fast. Either it can be from lower chamber, which can be either ventricular tachycardia or ventricular fibrillation, जिसे आपने देखा रहेगा मूवीज में जब ऐसे हार्ट रेट्स बढ़ते हैं तब शॉक दिया जाता है. So these are the reasons why they have this sudden cardiac death. Now, heart failure is a chronic progressive condition in which the heart muscle is unable to pump adequate blood to meet the body requirement. So, either it can be because of the left heart failure or it can be because of right heart failure. तो ये left और right क्या रहता है? See, in heart we have a right ventricle, that is the right lower chamber, and a left ventricle, which is the left lower chamber. Now, most of the cardiac activity, the pumping is because of the left ventricle. Suppose because of some illness, if the left ventricle is become weak, is unable to pump that much of blood, then what happens? The back pressure will increase in the lungs. Patient's lungs are flooded with fluid, extra fluid, that in our term we call as a pulmonary edema, where the patient suddenly becomes breathless. So that is a left heart failure. It can be because of right heart failure also, because of some pathologies of the lung or heart. Yeah, so sometimes there occurs clot in the lungs that can also lead to right heart failure. Or it can be a combination of both left heart failure as well as right heart failure. Now, the common causes of this heart failure is a left heart failure. That again, usme, there are other types. That is a systolic heart failure. Now, heart has two functions. One is the contraction of the heart, and second is the relaxation of the heart. So imagine if a pump is weak, it is unable to pump that much amount of blood. So that's a systolic heart failure, where the ventricular muscles are unable to pump blood adequately. And imagine now heart is surrounded by a covering called as a pericardium. Suppose this pericardium becomes thick, or there occurs some collection of fluid between this covering and the heart. So this covering is unable to heart to expand. You know? So heart is able to contract, but relaxation is slow because of this tight covering. So that's called as a diastolic heart failure. It can be either because the muscles of the heart have become stiff, so it is unable to relax, or there is a covering of the heart which is stiff enough, which is unable to relax properly. That is called as a diastolic heart failure. So because of which the negative pressure will increase and the back pressure will increase, and because of which fluid accumulates in the lungs. That is called as the pulmonary edema. Now, what are the common causes of it? The most common cause in our country is the coronary artery disease. The arteries which supply blood to the heart is called coronary artery. Now, suppose there occurs blockage in those arteries, or it can be because of the valve problem, the heart valves. Now, the left side, there is a mitral valve between the left upper chamber and left lower chamber, and there is an aortic valve between the left lower chamber and the aorta. That's called aortic valve. Suppose by chance this valves become either small size, stenosis, or it becomes leak. The door is not closing; it is just remaining open. That leak is a common cause of this heart failures. The third common cause is the hypertension, uncontrolled blood pressure. This is the muscles of the heart become stiff. Diabetes mellitus, and this arrhythmias, when the suppose many times patient's heart rate becomes very fast and irregular. The commonest cause is atrial fibrillation, where the atrial kick is lost. because of which also patient present with this breathlessness, heart failure, or it can be because of other problems, irregularities between the ventricular rhythms. So how to identify this patient's symptoms? What we call in our, what is the problem? What we ask to the patient, that's the symptoms. The commonest symptom is patient presents with breathlessness. That is difficulty in breathing. It can be on walking initially, later on, even at day-to-day activities, patient becomes breathless, or some patients are breathless at night time when they lie. After 2 hours, the workload on heart is increased, and because of the fluid collection in the lungs, they become breathless. That we call as a paroxysmal nocturnal dyspnea. The second symptom they have is swelling over legs. The legs become swollen, and what we do while testing, we press it with the thumb or three fingers and see how much is the depression in it. So that is called pedal edema. Third is the fatigue or weakness. Patients on doing the routine activity, they get tired because heart is unable to pump that much amount of blood. So the demand is not met up. Fourth is the palpitations. If they have sudden rapid heartbeats, rapid irregular beats. Fourth is the reduced exercise capacity. To do the same activities, they are unable to meet up because of the low pumping capacity of the heart. And they have a cough. This cough initially can be a persistent dry cough or with sputum. It can be a pink frothy sputum. What we usually occurs in a case of weight gain. Patients say that they have the weight is increasing. Now see, suddenly a rapid muscle mass can't increase. What can increase is the water intake. So they present with this weight gain. So main is this breathlessness. Second is this swelling of the legs, what we call pedal edema, fatigue or generalized weakness, palpitations, reduced exercise capacity, persistent cough, and is the weight gain. These are the common symptoms what patients present with. Now, there are some precipitating factors. What precipitate? Patients may be carrying these heart problems so many months, years, but why they suddenly precipitate is because of anemia. Anemia is a common cause where the hemoglobin content is hemoglobin level is less, or sometimes even though hemoglobin level is good, but they have a iron deficiency. Their iron levels are less. Now, this iron is required to carry the oxygen supply. So patient's hemoglobin may be normal, 13, but the iron levels are low. That's why they become breathless. So iron studies are required to see this patient why they're getting recurrent breathlessness, why they're recurring hospitalization. And if you correct iron by giving this ferric carboxymaltose, that is the iron injection, they do better and rapidly the improvement is there. Recurrent hospitalization is avoided. Second, is there any arrhythmias? What I said, atrial fibrillation is the most common cause where there is irregular contraction of the atrium because of which they land in recurrent breathlessness. Third common cause is the infection. The commonest cause is pneumonia. And nowadays, past 3 years, every one of us have witnessed this viral pneumonias. So recurrent pneumonias is a common cause. It can be bacterial or viral. So usually we recommend vaccinations for such patients, where if you vaccinate, the recurrent infection rates goes down. One is this hip vaccine, H influenza vaccine, pneumococcal vaccine. So these flu shots are given to prevent this recurrent pneumonias in patients who have underlying heart failure. Fourth is if they have alcohol binge or smoking, they should cut down on it, and the tobacco intake. So these are the few precipitating factors. So if I say the bachao, how to prevent it is, one is the fluid content should be less in their diet, the liquid intake, because the main problem culprit is the left systolic dysfunction and the ejection fraction and the pumping capacity goes below 20% or so. So one is the fluid intake should be less, salt intake should be less. Third, a routine exercise, if they are permissible, if they are able to do a routine, some walking around and home, that has to be done, provided the lungs are clear. Control of sugar and pressures are required, and to quit smoking and alcohol is required. how we diagnose such patients. Now, the diagnosis is very important. The basic test what we do is the ECG. The ECG, we get various things, whether the patient has underlying heart attack, whether he had a heart attack in the earlier days, that can be diagnosed on the ECG. Is there any arrhythmias, irregular beats coming on the ECG? So that can be picked up. Third, such patients of heart failure, many times they have a slow conduction in one chamber that we call as a left bundle branch block. The heart and the AV node, SA node, AV node, then it travels through a bundle of his, and there are two bundles, left and right. Now, suppose the conduction in one bundle is slow, that called as LVBP. So imagine if two people are doing one activity, separate time, they will take a long time. But imagine if two people are doing same activity at the same time, coordinatedly, the activity can be done easily. Same is the principle here. If they have a left bundle branch block, now, so the delay is there of electrical activity on the left chamber. That's why they get recurrent failure. Now, nowadays we have newer modalities of treatment where we call it the CRTD. We synchronize both the ventricle at the same time by putting a device, and because of which the pumping capacity increases. Both the ventricles act at the same time coordinately, and that's how they improve by putting a device called CRTD. So ECG can pick up this LVVV. When I say to my heart failure patient that if you want to ask one wish to God, you should ask that God give me LVBB. Why? Because these LVB patients, if they get treated by this device, their life becomes normal. So ECG helps. Second is this 2D echo. We do the sonography of the heart. That's called 2D echo to see how is the dimension of the heart, how is the heart muscle thickness, how is the pumping capacity of heart. That's called ejection fraction. How are the valves? So that helps to determine the pumping capacity of heart. Third is the X-ray to know is there a pulmonary edema, is the fluid in the lungs, which is seen like a white appearance, symmetrical, that's called batwing appearance, what we say. Is there a fluid collection in the lungs? Pleural effusions also are picked up. Fourth is we send a blood test called BNP, that's the brain natriuretic peptides. So this helps to diagnose the case. And for some patients, they may require other modality called as a cardiac MRI, which helps to identify is there any other cause why these patients are having this low pumping capacity. Is there some cardiac TB or cardiac sarcoidosis? Few diseases are there where if you treat those, things can be sorted out easily and the pumping capacity improves. Now coming to the treatment part mean I feel the treatment revolves around not only by medicines but also other things. Imagine our this building, it has something like a foundation, a pillar and a walls. Same way heart failure patient, they have to have a balance between the fluid, the salt and the medicines. The three things have to be going together. It's not only medicine which will improve. So what in diet we say is restrict the fluid intake. The water intake should be less depending upon the clinical examination or IVC size, what we do on the 2D echo, we decide, and the ejection fraction, we decide how much fluid has to be taken. But usually it's between 1.2 to 1.5 liter. The fluid content has to be less. Second is the salt intake. Most of our Indian diets, they have a lot of salt intake. So salt intake should be restricted almost 5 to 6 gram, less below that if possible. Second, indirect salt intake in our Indian diet is quite high. Like we have a lot of papads, pickles, chutneys, the bakery items that has to be less because the biscuits and all this will have a lot of salt, sodium, and that will cause this recurrent breathlessness. Third, immediate relief. What when patient comes with breathlessness to us, what we give is the water pill, that is called diuretic. So we give this injectables or tablets to remove this extra fluid from the body so that the breathlessness component is taken care of. They pass extra urine so that extra water is passes through the urine. Nowadays, because of the recent advances in the pharmacotherapies, very beautiful medicines are available and they are available in our country too. And even now, after loss of patent, all these medicines which were quite costly enough, where most of our patients were unable to afford these medicines. Now, because of off patency, things are easily available and everyone can afford those medicines. The commonest and the most potent molecule is that arni. RNA is a molecule. What is the short form? It is a angiotensin receptor neprilysin inhibitor. So this RNA is a beautiful molecule which does miracles. We have seen patients. You start the molecule within few months, the EF improves drastically, and the requirement, the recurrent hospitalization rates have gone down. Even the patients sometimes they were on this requiring this device, what I said, CRT device. They don't require now because the pumping has improved. Patients in COVID time, we have seen patients whose pumping was so low, and we have started with this RNA molecule who were on a heart transplant registry, who were supposed to undergo. Now, the because pumping has improved, the heart transplant is out now. So this RNA is a very potent molecule, very important molecule, but it has to be started on a monitoring basis. You can't just take it over the counter. Frequent hospitalized OPD visits have to be started, and accordingly the molecule dose can be adjusted, looking at the creatinine, potassium, the blood pressures, and other parameters. The other molecules in armamentarium are this ACE inhibitors or beta blockers. Beta blocker helps to control the heart rate. So the other thing is the mineralocorticoid receptor antagonist like aldactone, and the newer thing is this SGLT2 inhibitor, that is a sodium glucose transport inhibitor. So this SGLT2 inhibitor like dapagliflozin, these molecules are there where now the if you start early at and multiple molecules acting on different pathways, if you start early, the frequent hospitalization is avoided and they do better. The quality of life improve. Now, in our hospital in Fortis Vashi, we have a dedicated heart failure clinic also, where we see a lot of these heart failure patients. We guide them regarding the diet, how much exercise they can do. We have a dedicated physiotherapy department with us where we do cardiac rehabilitation. So, how the life can be improved in a better way, and how to adjust those medicines, diet, and fluid that can be taken care of. Where we monitor regular blood pressure, weight, regular electrolytes. The potassium level is very important in these patients. Sodium level sometimes can go low. The creatinine, and we titrate the medicines accordingly. So we have this dedicated heart failure clinic here where we do all this. It's an integrated approach where we have a dietitian, we require a physiotherapist. Our nursing team is the main key pillar of this treatment, and so like this, we take care of this heart failure patients. Now, second important thing what we require is to control the blood sugars, which are equally important, and to control the blood pressures, because every time these patients develop this accelerated hypertension and all, they land with failure again. Now, there are something like a end stage heart failure. Some patients who even with medicines they don't do better. They have recurrent hospitalization. Where I said if they have this left bundle branch block, and on 2D echo if we see a LV dysynchrony, there is a dysynchrony between the two chambers of the heart, left ventricle and right ventricle. Then this a procedure called CRTD or CRTP, that is a cardiac resynchronization therapy. Both ventricle synchronize to work together. So it is a boon to this heart failure patients. It's like a pacemaker, like a device, and the wires goes to the right ventricle, left ventricle, and the coronary sinus. And some patients who have this irregular or the fast ventricular rate, we put a defibrillator lead also, where something happens, this inside the machine will give a shock and to protect the life. So these are the few modalities which have made the life better. Now sometimes the patients are planned for a for a transplant or thing, and the patients are going bad. Where we have something like a left ventricle assist device that's called LVAD, which is a bridge to the therapy. But only it's a hindrance is the cost. Especially in our country. So in that case, what I said, this CRT device, they do better where, or we have something like a his bundle pacing where we pace the his bundle so that it will help to synchronize the chambers. So that is again a modality where if the cost is an issue, we can try with the physiological pacing. Then the last option in this end stage heart failure remains the heart transplant, where there is a registry of our government where we have to have on the transplant registry the name enrolled, and then we evaluate the patients, for their transplants, the different parameters, the kidney wise and otherwise. So these are the various modalities. One is the pharmacotherapy, second are these devices, third is the transplant. So earlier days, we used to read all this transplant and all only in the books, but nowadays in our country it is so easily available and things are doing so good. So anybody who has this undue breathlessness or excessive weight gain or undue fatigue, And this patient should go to a doctor, getting himself evaluated. What is the cause for it? Every time you can't label any patient as asthma. Sometimes it's a heart-related breathlessness. So they have to get evaluated for this heart failure. And earlier the treatment, we have a lot of options available, and things can be dealt up in an early stage. So and control the diabetes and the blood pressure, that is equally important. I think I have covered most of the things. So uh, I think if you have any questions, I can go ahead with that. Thank you. Good day.